it happens to millions of women. All of a sudden, you look down at your legs, and there are these unsightly spider veins. In New York, we call them roach veins. No. Anyway, these things are really quite hideous sometimes, and they can be an embarrassing problem. But fear not, help is on the way. Our next guest can zap away those unsightly veins instantly, and he's going to show us the procedure right here today. Please welcome dermatologist Bruce Katz. Dr. Katz, director of the Laser and Skin Aesthetics Center here in New York. How are you?
Pleasure to be here. Thank you.
Okay. Thank you. What exactly is a spider vein?
Well, spider veins are really a network of blood vessels that go through the skin.
Those little things. Looks like a road map.
Exactly. They look very spidery, and they can be purple or red, and they can track over the entire legs.
Or like blue as well, right?
Blue.
What's the difference between a spider vein and a varicose vein? Because it sounds exactly like a varicose vein, right?
Well, actually, a varicose vein is really the bulging type, the thick, ropey, bulging veins.
That pop out of your skin.
Yeah, and those are less common. Actually, most women have spider veins, which are just the flat ones. They just look purple, red, or blue.
Right. Okay. Do men have these as well as women?
Men can have them, but it's more common in women.
Okay. And how
Only on your legs? Or can you get
have it on your
places
face. You get those little spidery, red, streaky veins on the face, too.
And where do they come from?
On the face, more often from sun damage. Just
really?
from being in the sun too much.
I have them on my face.
Yeah,
another reason not to go in the sun.
Yeah, well, what causes them on your legs then? Because my mom has them as well, and I thought that she got them from standing on her legs too much from being a stylist. That's what I was always told.
It's really, it runs in families. Spider veins occur because someone's mother had them or grandmother. Not really from being on your feet.
Really?
Very common problem.
People think that's the reason.
Yeah.
Okay, and now you have new treatments. They used to do something about injecting something in you to get rid of them, right?
Right. The
you
previous
don't use
treatments, well, we used to use a lot of injections or sclerotherapy, which was a very frequent treatment. But now we have a new type of laser called the VersaPulse, which can vaporize these blood vessels and make them actually disappear right at the time of treatment. So it's a real revolution in treatment. Oh, yeah.
Now, we have a victim, I mean a person, who's come on the show to have these things removed right here on television. So let's go over to Lorna, who has consented to this treatment right on the air, ladies and gentlemen. And
everyone needs to put these goggles on because the lasers, I guess, are dangerous to your eyes. Is that what it is?
Okay. Lorna, why did you want to do this?
They're ugly. And as you get older, you just look at yourself and you see these things popping up.
But you can hardly see them.
No, here's California.
Oh.
And then you got a little one over here. And it just looks like you get like little road maps. It's true.
Little
it's a
road maps, yeah.
And they're all over. There's more, but...
Okay, everybody has their goggles on?
Okay, now...
Why do we have to have these goggles
Ready, set, ski.
Well, the goggles protect everyone's eyes from the laser light.
Oh, the laser light. Oh, I see.
Okay, yeah, you can lie back if you'd like, Lorna. Now, this is the actual chill tip. This is a chamber of circulating cold water that we chill the skin with, and this allows the laser beam to go through the skin without damaging the skin above and just treating the vein below.
Okay, go.
Now, what I'm going to do is, this is a red light which shows the laser beam, the area where the laser beam will hit the vein. And Lorna, you're just going to feel a little zapping sensation.
You nervous, Lorna?
That's the first pulse.
You felt it?
Yes.
That's it? Did it hurt?
No, you know what it feels like?
What?
Like when you pinch yourself when you're going to do a thing with a needle, you know, like a pin?
Yeah.
And you prick yourself?
Yeah.
I'm being pricked.
Wait a second, and this is all you're doing?
That's all we're
doing.
doing.
Like buzzing sound or something?
No, this is the actual laser
I thought it was going
light
to sound like a drill at the dentist.
destroying the blood
It's like
vessel.
little pins.
Now, if you were to take these out, all of these in her, she's got a few of them, right?
Thank you very much.
It doesn't look that bad, to say the truth, but I know it's bugging you, Lorna.
Oh, it is.
And that's what's important. How long would it take to get them all out? How many treatments?
Well, we can actually treat a lot of veins in one session. We can just, see, I'm just scanning the laser light right over the blood vessel, and we can just do this in 15 minutes. We can probably take care of all of Lorna's veins right now.
And are there any side effects to it?
People get a little bit red and puffy right after the treatment.
Well, we actually have a before and after picture of someone else.
Oh, let's
There it is.
Actually,
Yeah, we're not going to show Lorna after because she'll be red for a while.
this
right?
is a woman well, you're red for about 2 or 3 days after.
Okay.
But this is actually a photograph of someone before they had a treatment. We did this person a few weeks ago. The top photo is the vessels, the veins before, and then 2 weeks after, you can see most of the veins have disappeared.
That is a lot better.
And
Will
how
she have
long
to come back to get even the bottom?
Oh yeah, you can finish those off. You
How
can
long do
see,
these results last?
once these veins are gone, they're gone for good.
Really?
Once we destroy them with the laser, the VersaPulse takes care of them completely.
Okay, how much would a treatment like this cost then?
It's a few $100s for a session.
And how many sessions?
Well, that really depends on the number of veins one has. If you have a few veins, one session might do them. Some women come in and have road maps on their legs, and you need a few sessions to do it. But you can really clear them up very nicely.
Well, if it's just Rhode Island, it's not that bad.
When
Well, what about in the face?
How do you feel, Lorna?
Well, actually,
Feel
the
good?
Yeah,
the
it's not
broken
bad
blood
at all.
vessels on the face, we can usually treat in one session. Just clear them up completely.
But would they be red and puffy as well? So you have like...
Very slightly on the face. You see it more in the legs. On the face, it may look a little bit red, but you can cover it with makeup right away.
Yes, my nose.
And
Lorna
that's
has a
right.
spider
I have
vein
one on
on
my
her
nose.
Right.
Yeah.
Getting that
That's
removed?
what brought
care
me
of
to
that,
him in
too.
the first place.
Okay, you
That's
feel
right.
okay, Lorna?
I'm fine.
Thank you, sir.
And your
see the
legs
vein?
look beautiful.
And you see
Better?
the vein
Is
is
it better?
gone,
Yes.
and that's it. We can do the rest
Thank
of
you,
this vein
Dr.
if you'd like
Katz
to
and
see.
Lorna. We'll be right back.
Thank you.
Okay.
And she doesn't like puff up too much. So people have different effects to it.
That's all it is. Just a little bit red there.